Hi, viewers. Once again, I'll take you through some other services that we offer. We also offer the general ultrasound services, where for pregnant women, we take it through the pregnancy the journey by doing for you obstetric ultrasound scan, right from conception to delivery. In the obstetric scan, at every stage, there are specific things that we check. At the conception stage, at around 6 weeks and above, we check on the locality of pregnancy. Is it in the right place? We check on the type of pregnancy. Is it single or twins or triplets? And also we check any abnormalities surrounding pregnancy, like bleeding that we need to miscarriage. So we may report a threatened miscarriage at that stage. And also the most important is to detect if there's already life in that pregnancy by checking for the heartbeat of the embryo. After that, at the subsequent stages, there's specific things that we check. At 18 to 22 weeks, we do what we call the fetal anomaly scan, where we check any structural abnormality in the fetus. Then after that, we go ahead as you near delivering. We check on now the physics around the fetus, the amniotic fluid index, the resistive indices of the mid-cerebral artery, the umbilical artery. We check cord around the neck. We check the adequacy of the amniotic fluid, the cervix, the presentation of the fetus in preparation for your birth. It will help the doctor to plan for on how you're going to give birth. Other than obstetric scan, in women, we also do the general pelvic scan for both male and female. We also do abdominal ultrasound, where we are checking the abdominal organs for both genders. For children, we are checking the abdominal scan. We're checking the liver, the kidneys, the spleen, the pancreas, the abdominal bowels, and everything. In men, we also check prostate gland. We do the scrotal ultrasound, testicular ultrasound. Remember, this is our fertility center that even men have to participate in this fertility journey. The process of getting a child, both are involved. As women are going through their tests, we are doing ultrasound, we are doing HSGs, we are doing some tests. Also for men, we do testicular ultrasound to check if the testicles are structurally healthy, because sperms are produced from the testicles. We are checking if they are structurally okay. So, and some other tests that the doctor may request in the lab, like semen analysis and so forth. Mine is to encourage men, don't fear. The journey of getting a child, two of you should walk. In the African setup, we like blaming women, but you never know. So I encourage men, don't be embarrassed. Come accompany your wife as you go through this fertility journey, as the doctor takes you through this fertility journey. Also for the children, we do the abdominal scan. Generally, we do the cranial ultrasound. Sometimes we may, after delivery, the pediatrician may check the baby and says we do cranial ultrasound just to check inside the brain of the baby if what we saw while the baby was still in the womb is it still there or not, and some other things that may initiate the cranial ultrasound, where we use the long probe to put at the fontanelle just to check the brain of the baby. So we do ultrasound for all ages in life and all genders, both male and female. And also when it comes to, as you can see, this flat, we call it probe, or we call it transducer. This one we use to check for the blood vessels. It is also the one used to scan breast ultrasound in women. It is also the one used to do testicular ultrasound scrotum, and the small parts, small organs like the testicles, the thyroid, and also it is the one we use for Doppler scan to check the blood vessels. Maybe the legs are swollen and you want to check for the deep vein thrombus. If there could be a clot in the deep vein that causes your leg to swell, we check with this. For cellulitis, we check with this. For carotid, the major blood vessels that supplies your brain with blood, we check using this. It will help us to detect any clot, any plaque in the arteries, any thrombus in the veins that will help for quick action to be taken. Also, this one, we use it to scan for superficial soft tissue swellings. Maybe we want to check there's a swelling on the head, there's a swelling anywhere on the body. We want to check if it's a lymphoma or which kind of swelling is it. Is it an abscess? Do we use this? Also, this one help us to check for joint effusions and also to check for ganglions on the wrist joints and some other parts of the body. So these things, as you can see them, they are made in different ways. We call them probes or we call them transducers. And with the machine that we have and the setup of our facility, this is our activity center, we only need this three. But if you go to some other facilities which are specialized in their own way, maybe they're doing echocardiography, you will find these probes are different and they'll come in different shapes and sizes. So depending on what you're doing as a facility and the setup that you have. So for us, this three was enough to cater for all our patients, both male and female, and both young and old. We offer general ultrasound scans, and we offer general ultrasound scans means anything in the human body, we can do an ultrasound. Be it breast, be it thyroid, be it testicular, be it superficial soft tissues, be it skin swelling, be it to check for the blood vessels, be it to check for what. We can do all the ultrasounds at Mombasa Laparoscopic and Fertility Center. Other than the general ultrasound, as I said earlier, we have a specialized ultrasound where it has separated us here in a special way, where we do endometriosis mapping scan, focused and detailed endometriosis adenomyosis scan. That has separated us so well. We have been tried and tested. And as I told you earlier, we are approaching 90% accuracy when it comes to diagnosing endometriosis using an ultrasound. When it comes to obstetric ultrasound, let me just take a few minutes to talk about obstetric ultrasound at the anomaly scan. Make sure between 12 to 14 weeks of pregnancy, you do a scan. That will help us to detect what we call the Down syndrome. There's something we measure at the back of the fetal neck where we call it nuchal translucency thickness. Then it will help us to see if in some way the baby may be born with a Down syndrome. Then between 18 to 24 weeks, we do what we call the anomaly scan. Anomaly scan here means we are checking on this. Is the baby a normal human being structurally or anatomically? Does the baby has 5 fingers on both hands? Does the baby has 5 toes on both legs? And are both legs equal in length, or one is shorter than the other? Are both hands equal in length, or there's discrepancy in length of both hands? I believe you've seen somewhere where some people have shorter hand than the other. Some people have shorter legs than the other, so they go for a specialized kind of shoes. We will analyze the brain of the baby, where we will check for any anomaly, any chromosomal disorder. We will check the brain if there's any reticulomegaly, hydrocephalus, massive fluid collection in the brain. We will check any abnormality in the in the brain. Then we'll go ahead and check the spine. We'll analyze the spine from the base of the skull up to the tail end. We will check if there's any abnormality in the baby's spine. Then we'll check the rib cage. We'll check the abdomen. If there's any abnormality, we'll check the heart. We'll check the orientation of the heart. Is the heart of the fetus oriented on the correct side, on the left? Does the heart has the 4 chambers? Is there any abnormality in the heart? Then we will check the abdomen. We'll check the diaphragm. We will check the long bones. We'll check the facial features of the baby. Does the baby have the cleft palate, cleft and nose? Does the baby have the normal facial features of a normal human being? We'll check the eyes, the distance between the eyes. We will check the nasal bone. We will check everything, the ears, so that we are sure the mother this problem, or it is a normal human being structurally. Then after that, we'll check the placenta, and this what we call grading of the placentas, where we will do the grading at specific stages. You will check if the placenta is okay. Is it normal? Is it attached well? Is it detached? Is there any mass in the placenta, any clot in the placenta? All those things we'll check. Then we'll check the amniotic. Is it adequate for your baby? After that, we will check the blood supply to the baby's brain. Is the brain of the baby suffocated of oxygen or of blood, or is it getting enough blood? Is the baby under stress, or the baby is free? So we'll check the blood supply through what we call the mid-cerebral artery resistive index. We will check, and also we will check the blood supply through the umbilical cord. We will take what we call the resistive index of the blood supply through the umbilical cord. Also, we will check the general growth of the baby. Is there any growth retardation? Is the baby growing well corresponding to the gestational age? It will prompt us even to check what we call the ductus arteriosus resistive indices. We check a lot of things when it comes to an normal scan. Then at the end of it, we give you what we call the physical profile score, where the normal physical profile score is usually 8/8. We check the amniotic fluid, the fetal heart, the breathing, and the fetal tones. Is the fetal tone okay? Is the nervous system of the baby okay? So there are so many things which we check on the fetal annual scan between 18 to 24 weeks. And also we check your cervix. When it comes to twins, we will tell you which type of twins. And also the most important to the spouses is checking on the gender of the baby. Checking on the gender of the baby. This one at Mombasa Laparoscopy and Fertility Center, we can tell you the gender as early as 15 weeks and above. Be it twins, be it single, be it triplets, we will tell you the gender as early as 15 weeks. And sometimes we even tell the gender as early as 13 to 14 weeks. But the best assurity is from 15 weeks and above. So we do a lot here. We invite you to come and visit. We invite you to come and talk to us. If you have any question, you can come and come and see for yourself what we offer. Come and see for yourself what we do. We take you through the fertility journey. We take you through the pregnancy journey. And men, don't be embarrassed. Men, don't fear. Accompany your wife in this fertility journey. And even the pregnancy journey. When God will do the miracle, even the pregnancy journey, walk through with the wives until the time of delivery. Thank you very much and welcome to Mombasa Laparoscopic and Fertility Center.